Hi everyone, this is Hilary RNY and this is my first video. I am actually post gastric bypass. However, this is my first video that I wanted to do as a way to help document the things that I'm feeling, going through, and really my weight story and the journey that I'm on. So I figured I would just kind of introduce myself and where I'm at right now. So I had gastric bypass surgery on November 30th, 2015 at Massachusetts General Hospital with Dr. Hutter. Um, I decided to have weight loss surgery probably mid-year, about May, June. That decision had been made, and I spent the summer having some appointments, and then here I am. So although this is when I committed to having weight loss surgery, I had thought about it beforehand. A couple of years ago, my doctor had brought it up with me. I had gone through some initial appointments at a separate hospital, and I didn't really have a good feel for that program. I met with a dietitian and she was 20 minutes late for the appointment. While we were talking, she was interrupted. She was just kind of typing down things that I was saying, and I don't think she accurately took into account my story, and I was not approved. But the reason I was not approved was because they said I needed to go to therapy. I've been in therapy for a long time. I just didn't feel heard by that program, so I decided it was not for me, and kind of went along with my life. I am a fairly active person. I did CrossFit for a period of time. And I really enjoyed that. So I was pretty active and thought that that would be a way for me to continue to lose weight. Outside of that, I also, I had tried Weight Watchers. I had tried books by Janine Roth. I had mindful eating. I had tried a lot of different things that weren't really helping me in the way that I needed to be helped. So a part of my weight gain story goes back a while ago. As a kid, I don't believe that I really had a weight problem. I was fairly normal in terms of weight growing up. The first time I ever really gained weight was when I was in college, which I do feel is a normal situation. A lot of people gain weight in college. So a large part of my weight gain, I believe, had to do with binge eating and emotional eating and my coping skills, to be serious and honest about that. Growing up, I had in my young adult life, had some pretty traumatic things happen to me. At the time, I didn't realize they were traumas. I just felt like it was a part of life, but the way that I dealt with them as an adult was not really productive. So I had a really terrible experience with some mean girls in high school. A couple of months after that, my best friend passed away in a car accident on her way to my house. Then I lost my grandmother. And then 3 weeks after I started college, I lost my father pretty unexpectedly from a heart attack. So I had had a lot of loss in my life and a lot of, trauma. When I was in college, I was, in this transition phase of being an adult and on my own, and I wasn't making the healthiest choices in terms of food. I went to graduate school and went to graduate school in a place that was very different from where I grew up. I was in the middle of nowhere. There weren't a lot of people around me. The only thing that I did was eat. It was a way to feel connected to my old life. It was a way for me to pass the time. It was a way for me to feel better about what was going on for me. So I ate, and I kind of got in the habit of that. I moved to Boston in 2008. I had a job that really kind of owned my soul. And I had a really, really hard time. I was binge eating all the time, just to cope and deal. I was in a relationship at the time with my college boyfriend, and I was sad. I didn't really know how to express that. So I had a lot going on. Food was my way of dealing with things. So I took some active steps to be healthy, really in 2012, where I really started working out, was in therapy, was really doing a lot of hard work, and I wasn't seeing any results. At that time, every time I would go to the doctor, something else was happening. There was always more bad news. So I'm 31 now. So by the age of 31, I had fatty liver disease. I had polycystic ovarian syndrome. I had, this is hard to talk about. I had high blood sugar, high blood pressure, sleep apnea, and I don't know if there's anything else that seems to be to run the gamut of the things that were going on with me. I was on 9 different medications at the age of 31. I didn't realize, and I thought it was all my fault. I didn't realize that there was more going on, and that, genetically maybe there was some sort of problem. I blamed myself. I thought everything was because I was making unhealthy choices with food. I worked out. I went to CrossFit. I did all sorts of things. I went through a coaching program that for health and fitness, which I really, truly enjoyed, but still wasn't seeing results. And, with my family history, my dad died at the age of 51, and too young, way too young. And on my mom's side of the family, that's the side that has, the diabetes and all these other health issues. So I was very concerned for my health. So I decided to have weight loss surgery this year, when in the summer of 2014, I had gone through a very intense treatment program for binge eating disorder, and I stopped binging for the most part. There were moments where I was having some instances of emotional eating, but not binging anymore. I'd started a different workout routine. I now go to Orange Theory Fitness, which I think is fantastic, and I recommend it. So I had all these things that I was doing, but every time my numbers kept getting worse and worse and worse, and I wasn't losing weight. I changed my diet, I had changed all sorts of things, and just nothing was getting better. My doctor recommended that I look into weight loss surgery because I was put on a medication that for my liver and for my blood sugars, that was causing me to just be so nauseous that I couldn't deal. I couldn't live the way I needed to live. I missed a lot of work as a result of it, and the medication was working, but the thought of, this is my life at 31, what's it going to be like in 20 years? Am I going to make it 20 years? So I had a long series of talks with my therapist, with my doctors, and decided that this was something that was worth doing. I honestly did not care about weight loss at all. For me, it was, I just want to be healthy. I don't want to be on these medications. I want the opportunity to have a happy life where I'm not stressed out thinking about medications and dreading every trip to the doctor, and I can live like a normal 31-year-old woman. So I went through some screening processes at MGH and had surgery on November 30th. I decided to have gastric bypass versus the sleeve because it was recommended to me by every single member of my medical team. Any specialist I was seeing recommended that because of the health issues that I was facing, and because that was the more important thing versus weight loss, that there was more data to back that up about reducing comorbidities, and that they had more data to suggest that that was a good idea for me. So that's why I did that. So I will likely do another video, but I'm going to stop this one here. But that was just, my weight loss, my decision to come to weight loss surgery. So yeah. I'm sure I will go into that a little bit more, but I'm just going to stop this now. So thanks for watching.